Honourable Peter Dunne.
Mr. Speaker, my question is to the Associate Minister of Health and asked, what specific, quote, corrective actions, unquote, will the Malvina Major Retirement Village be required to undertake following the recent Ministry of Health spot audit?
Honourable Joe Goodhue.
Thank you, Mr. Speaker. Ryman Healthcare Limited, the owners of Malvina Major Retirement Village, is required to undertake corrective actions to ensure improvement and compliance with the Health and Disability Service Standards after an unannounced inspection on the 30th of July this year in the following areas: management of and documentation around complaints, quality and risk management, processes for infection prevention and control, assessment of residents, care planning specific to individual residents, and the overall standard of care provided to residents. These corrective actions must be achieved within specified timeframes set out in the provider's certification schedule. The first due date for corrective actions is the 5th of September 2013, but the provider may implement corrective actions ahead of the required timeframe. The Ministry and Capital and Coast DHB are monitoring progress. The full list of and detail of corrective actions are contained in a 6-page document which can be found on the Ministry of Health website.
Supplementary question, Honourable Peter Dunne.
Speaker, how will the actions that have been agreed to be monitored to ensure that they are actually achieved within the timeframes that have been specified in the audit that the Minister referred to?
Honourable Joe Goodhue.
Mr. Speaker, the Ministry of Health will be closely involved in monitoring the changes required of Ryman Healthcare in light of this distressing case. The distressing events were found by inspection to have been substantiated. Steps to ensure improvements and a timeframe for change have been made clear, and the DHB will work with Ryman's to ensure their implementation. The Ministry also keeps a close eye on progress. But if the corrective actions are not achieved, the Ministry may take action under the Health and Disability Services Safety Act 2001.
Supplementary question, Honourable Peter Dunne.
Mr. Speaker, in the light of this distressing case, will the Ministry of Health be making any changes to its overall auditing procedures to ensure that these types of situations can be prevented from recurring in future instances?
Honourable Joe Goodhue.
Mr. Speaker, since National came to government back in 2008, we've taken a number of initiatives, including publication of audit summaries online, introduction of spot audits and third-party accreditation of auditors. We're also rolling out a comprehensive assessment tool, but it would be fair to say that despite all of that, when a certification audit happens, and midway between that, the audits can in fact be given a 1-year certification right up to a 4-year certification, and it will give you an idea of how many actions need to be changed. But in midway, there is a spot audit as well. Despite that, things can still go wrong in rest homes, and therefore we very much rely on the public to contact the Ministry of Health or the DHB if they are concerned about anything, because something could go wrong the day after an audit is conducted. So this is very much a partnership between the public and the audit and regulatory environment.
Question number 8, Honourable Damien O'Connor.
Thank you, Mr. Speaker. My question